everyone, and welcome to the video on intramuscular injections in the horse. I'm going to be using my trusty steed here today to demonstrate where the landmarks are and where to give intramuscular injections. There's a few places in the horse that you can give intramuscular injections. The most common site is the neck. There's a few reasons for that. A, it's the easiest when there's only yourself here, and often small volumes are great to just go in the neck. If you are giving your horse big volumes, then often the rump or the brisket or the breast muscle are the better places. But I'll show you all of those today. So first I'll start with the neck. Now there are a few important structures in the neck, and I'll just get my little pen here. So in the horse, this is the scapula. So this whole area here has a bone, so we can't inject anywhere in that area there. So this area is out. Then we have what we call the nuchal ligament, which is a ligament that pretty much holds the horse's neck up. Now that has no blood vessels in it, so there's no point putting anything in the nuchal ligament. And then you actually have the cervical spine, oh, my pen's gone a bit skew-if there, which runs like that. So again, you don't want to be putting anything into the spinous processes of the horse. So this is what we call the safe triangle in the horse, this area here. So anywhere in here is pretty safe to inject. So what you tend to do is, again, watching your positioning, because again, if you put a needle in a horse, sometimes they will decide that they want to push you out of the way or strike at you with their front legs. So never stand here when you're going to give an intramuscular injection. You always need to be to the side of those front legs. The other thing to mind is the mouth of the horse, because they are often good to swing around and bite you. So try and have someone hold the horse's head if you can. So this girl, I know her like the back of my hand, so I'm pretty comfortable doing injections with her. So what I do is I get my landmark, so I'm going to inject in this general area here. And what I like to do is just give a pinch of skin, and that just gives them something else to focus on rather than what you're doing. So I open my needle, and I put my needle and syringe separately. So I open my needle, don't ever touch that end because that's what we want to keep sterile. So I pull it out, grab my pinch of skin, and push it in really quickly because it's painful going through that skin, but once you're through the skin, that's fine. And always do it to the hub of the needle. So I've pushed that all the way into the hub, which is the end point of that needle, and then I attach my syringe and inject. So that's the neck, and then I just take it all out. The other places to inject are in the horse. They have a lovely muscle down here, which is called the pectoralis, or the brisket is often known. And there's two sides. You can give intramuscular injections just straight into that muscle. Again, watching these legs that they're not going to come forward, but straight into the hub in these positions here. Now the one important thing with intramuscular injections is always pull back to make sure that you're not in a vessel and you don't have blood. So just pulling back to make sure that that's not in a blood vessel is also very important for some drugs. Now another point to inject in the horse, I'm just going to make sure that my trusty steed does stay, is in the big rump muscle here. So they have a massive muscle here. And I'll just grab my pen to show you the landmarks. So I'm just going to show you the landmarks for the intramuscular injection in the rump. So we have the point of the hip here, so that's that nice bony point there. And you can palpate that on even the fat horses, you can feel that. And then the point of the tail, which is just here. If you draw a line in between those two, and then pop your hand in the middle of that line, so roughly there. So anywhere in this circle is the best place to inject in the rump. And again, there's a few techniques in the rump. You can do what we call the element of surprise and just jab it in, or you can do the warning shots, and you can do 1, 2, 3. See how I'm punching? 1, 2, 3, jab. So that's another position that you can do that. This is the most important one, to be well and truly away from the horse if they're going to kick. I have a fear of needles, so if someone was going to put it in my bum, I can tell you I'd kick and scream. So when a horse kicks, this leg comes forward and it doesn't arc out like that. So when you're doing this, you need to be well and truly out of the way, and you really need to be up here so that if that horse brings that leg forward, it can't get you. So standing well and truly out of the way like this, and this is the position that you would be doing that injection in the rump there. And again, making sure you go all the way to the hub. Once you attach your syringe, making sure you're drawing back and there's no blood in the position, and then inject your drugs. So that's the three positions for intramuscular. We've got the rump, we've got the neck, and we've also got the brisket. Thanks for joining us. Bye.